Psychology provides a comprehensive framework for understanding systems of health, distress and growth by examining the interplay of cognitive, emotional and social factors that influence human behavior and development. In this context, health refers to a state of complete physical, mental and social well-being, not merely the absence of disease or infirmity. Distress encompasses emotional suffering and psychological discomfort that can arise from unresolved conflicts, maladaptive behaviors, or existential concerns. Growth involves the process of developing and maturing psychologically, emotionally, and socially, characterized by increased understanding, resilience, and fulfillment. By exploring various psychological theories, we gain insights into how individuals navigate these aspects of life, providing pathways to enhance well-being and address challenges. Erikson's psychosocial development theory posits that individuals experience 8 stages of development throughout their lives, each marked by a specific conflict that must be resolved for healthy psychological growth. For health and growth, successfully navigating these conflicts leads to virtues and strengths that enhance personal development and well-being. For example, during the intimacy versus isolation stage, young adults seek to form meaningful relationships. Successfully resolving this conflict by establishing strong social bonds promotes emotional health and personal growth, whereas failure can lead to distress and feelings of isolation. Erikson's theory highlights the continuous influence of social relationships on our mental health and emotional development, suggesting that unresolved conflicts in earlier stages can manifest as distress or mental health issues in later life. Jean Piaget's cognitive development theory focuses on the stages of mental growth in children, emphasizing how cognitive processes influence understanding and interaction with the world. Piaget proposed 4 stages: sensor-emotor, pre-operational, concrete operational, and formal operational. Health and growth in children, according to Piaget, involves successfully transitioning through these stages, which allows them to develop reasoning, problem-solving skills, and critical thinking. For instance, during the concrete operational stage, children learn to think logically about concrete events, which fosters academic growth and cognitive health. Conversely, if cognitive development is hindered, children may experience distress or learning difficulties. Piaget's theory underscores the importance of providing supportive learning environments that encourage cognitive exploration and development, thereby promoting psychological and intellectual health. Terror management theory, TMT, suggests that much of human behavior is motivated by an unconscious fear of death. According to TMT, cultural beliefs and self-esteem act as buffers against existential anxiety, promoting psychological health and growth. For example, engaging in culturally significant activities or adhering to personal values can enhance self-esteem and provide a sense of purpose, mitigating distress associated with mortality awareness. Conversely, when individuals face threats to their cultural worldview or self-esteem, they may experience increased distress and anxiety. TMT highlights the role of existential concerns in shaping behavior and suggests that fostering strong cultural or personal identities can promote mental health by providing meaning and reducing existential distress. The theory of planned behavior, TPB, posits that individuals' behavior is driven by intentions, which are influenced by attitudes toward the behavior, subjective norms, and perceived behavioral control. This theory provides a framework for understanding how intentions can lead to health-related behaviors and personal growth. For instance, if a person believes that exercising is beneficial, positive attitude, feels social pressure to exercise, subjective norm, and believes they can successfully engage in exercise, perceived behavioral control, they are more likely to adopt a regular exercise routine, promoting physical health and psychological well-being. Conversely, a lack of perceived control or negative attitudes can result in distress or unhealthy behaviors. TPB emphasizes the importance of addressing these 3 components to encourage positive health behaviors and personal development, illustrating how cognitive factors can influence growth and well-being. Psychological theories offer valuable insights into the dynamics of health, distress, and growth. By understanding the mechanisms underlying these processes, individuals and professionals can better address challenges, promote well-being, and facilitate personal development throughout the lifespan.